Some microscopes are designed so an assistant observer can also see what the main operator is seeing. These microscopes have a beam splitting device. This splits the light between the dentist and an assistant observer and can also be integrated with various types of digital recording devices. With the digital documentation capabilities, the dentist can keep working and have the assistant capture images as they proceed through the treatment. These images can be shared during examination, during the treatment, and post-operatively. The microscope with the beam splitting device allows the assistant to see right where the dentist is at in the treatment, so he or she can be prepared for the next step of the procedure. Overall, improved vision with these microscopes advances patient care and aid in the education of the patient, staff, and the referring dentist. The endodontic obturation system is a new system designed to obturate, quote, close bracket, fill the canal once the dentist has completed the preparation. This system is powered by a cordless unit that warms the filling material, neither brand name material or traditional gutta-percha, and then allow the dentist to place the material into the canal for vertical and backfill obturation. Sterilization procedure. Endodontic instruments must be sterilized before they are used and during the cleaning and shaping of the canal. Sometimes instruments are sterilized at chairside using a small glass bead sterilizing unit. A flame may also be used at chairside to re-sterilize endodontic instruments and burrs. Reamers and files are fragile and should be examined closely before use. If there is any concern about the ability of the instrument to function properly, it should be discarded. Some manufacturers recommend one procedure use for reamers and files. Endodontic procedure. Common endodontic procedure that the dental assistant should be familiar with are root canal treatment, endodontic retreatment, pulpectomy, and pulpotomy. Root canal treatment. Root canal treatment is usually completed in 2 appointments, but this varies depending on the degree of infection and the dentist's judgment. The dentist may decide to postpone filling the canal to allow more time to treat the infection. When this occurs, the canal is irrigated, sometimes medicated, and a temporary filling is placed in the coronal portion of the tooth. The patient is rescheduled for a continuation of the procedure. The procedure begins with the dentist opening the coronal portion of the tooth with a dental high-speed handpiece and burrs. This is followed by cleaning and enlarging the canal. Restoration of the canal is also known as obturation. During this phase of treatment, the pulp canal is permanently filled and sealed. The steps involved in a root canal treatment are outlined in Procedure 24-2. General steps in root canal therapy. The following general steps in root canal therapy can be divided into 2 or more appointments, depending on dentist's preference and the extent of the infection. Steps 1 through 8 would take place on the first appointment. Steps 6, 7, and 9 would be done at the second appointment. Once complete, the patient would follow step 10, administer the anesthetic, isolate the area, gain access to the pulp, locate the canal, remove the pulpal tissue, enlarge and smooth the root canal, irrigate the root canal, place temporary filling, obturate, seal the root canal, refer the patient to a general dentist for